Prednisolone is on page 877 of your Lenny's textbook. So it's an anti-inflammatory synthetic form of your steroid glucocorticoids, which is naturally produced in your adrenal glands. We know that. So what exactly is it used for? We know it's used for to suppress anytime you have an autonomic disease, like psoriasis would be an example. But in this case, in the PowerPoint, they explain it as your classic asthma type patient, so chronic asthma, because you're trying to suppress that hypersensitivity reaction, if that makes sense. All right, so prophylaxis for chronic asthma, it suppresses inflammation by reducing the bronchial hypersensitivity, and also it decreases that mucus production. It's considered a pregnancy class C, which I read in the textbook that it says fetal adrenal hypoplasia is a risk. And so post-birth of the parent of a mother who chose to take this medication, they want to check and monitor that infant for adrenal insufficiency. That's the first thing that they want to look for. All right, so mostly I like to focus on the adverse effects because it's very comprehensive. All right, so our adverse effects, we're going to get that adrenal insufficiency risk over a long period of time. Your osteoporosis, you may want to give them calcitonin or biphosphonates, or you may just want to get their calcium levels, make sure they're in normal levels. Also, prednisolone, because it will lower your suppression of your immune system, it may actually mask an infection because your body may not react the way it should if it was normally fighting off an infection, which is very dangerous. Your body in prednisolone is going to retain that sodium, it's going to retain that water, and it's going to do the opposite with potassium. Potassium, it's going to lower. And so this is where, like, think of retaining, like bloating your face, think of that, like, big bloated, sodium, water being retained, potassium getting lowered. But because of this potassium being lowered, there's a drug interaction with stuff like digoxin. If you have low potassium, digoxin is going to be more readily available in the blood plasma, which means you can get to those toxic levels of 0.5 to 0.8 nanograms is what you need to stay between. So if you go above that, you're getting into those toxic levels, which is really important to remember. If you have to take it together, which I don't know, maybe this happens, I don't know if it's allowed, but you're going to have to decrease that digoxin dose to get to the therapeutic levels, but it's really dangerous. I consider it drug-drug interaction. You may want to have to increase your glucose because your glucose is going to get rise in your blood, and that's really dangerous. So think of your diabetic patients. You may have to talk to your doctor and have that insulin dose increased. All right, so other things to watch for is you may have a muscle weakness, which is called myopathy, or growth delay. Growth delay is also really important to think about because if we're giving it to these children, they're growing at this time in their life, and they need to be consider of like not having these side effects. So they may want to do an alternate day therapy while still getting the benefits. Or the mother with the breastfeeding, they may, if they're taking a large enough dose, it may affect the baby and delay their growth. So just things to be considering of the benefits versus the risk. Cataracts and glaucoma is a risk, and peptic ulcers. So you want to think of contraindications with NSAIDs. If you take a collaboration with NSAIDs, you're at higher risk for ulcerations in that area. One of the interesting side effects that is more specific for this prednisolone of a glucocorticoid would be your iatrogenic Cushing syndrome. You're going to see that pot belly, the moon face, like that, and you're going to see that buffalo hump. So if you see that, the nurse or the doctor, well, the doctor is actually going to be discontinuing that medication and seeing what other possibilities there are. But you want to notify your doctor if you start to see a pot belly, a moon face, and your buffalo hump. It's just remember this, contraindicated for live vaccines. You're lowering your suppression of your immune system, and you try to throw in a bacteria, your body's not going to fight it like normal, and plus, you can actually be masking an infection with this medication. So you may not even feel the infection because your body's not actually fighting it. It doesn't mean it's not there, if that makes sense. All right, so we know that potassium depleting diuretics. Potassium depleting diuretics, you're going to be losing that potassium, and you can even further go hypokalemia. So you don't want to be taking these potassium depleting diuretics. Your digoxin, you're more at risk for toxicity on your NSAIDs and the growth delay. So If you need to discontinue, make sure, like, as the nurse, we're trying to stay educated. The doctor actually does the prescribing, but you need to discontinue very slowly because you can have a rebound effect of your body, like, freaking out. And because your body's been giving something that's, like, hormonal, it's getting used to it. Administering, there's many routes that can be given. It can be IM, IV, sub-Q, topical, intranasal, inhalation. I mean, you name it. You got it oral also. Also, it's really important because it affects potassium to know those potassium levels. 3.5 to 5 milliequivalents per liter is the adult value. Here's the question. What is the pediatric value? Well, it says what I found online was 3.4 to 4.7 milliequivalents per liter, but it's very dose dependent because it depends on their weight. Kg is usually what we go by, so we usually look at the bottle of what that would be for, or the labs, which is determined based on the patient's weight because children are just like all different sizes. So that is everything for prednisolone. The only thing that I have extra that I feel like is very important is what are your signs and symptoms of hypokalemia would be your fatigue, it's right here, muscle weakness, fatigue, and your irregular heartbeats, because remember, potassium affects your heart. Again, muscle weakness, fatigue, and irregular heartbeats. So that is everything for prednisolone, and good luck studying.